I'm Dr. Fiona Lovely, and this is the Not Your Mother's Menopause podcast. I'm taking the taboos of menopause and perimenopause and bringing light to the dark. No bullshit, no shame. It's time for us to gain a new paradigm in female health, out with the old and in with the new, and I'm bringing fresh perspectives from someone in the arena. I've been practicing women's health for nearly 20 years, and I'm spilling the tea on what it means to live at midlife, knowing that the best is yet to come. I'm sharing my Gen X approach to living through this transition. Sassy, a bit sweary, and always honest. Tactical tips and instantly usable information is my aim. I hope to make you laugh and that you learn something new that helps you embrace the change. Together, we bring power to the peri. Onward to the podcast. You know, one of my favorite parts of this job is that I get to spend time with people I would probably never meet otherwise that are just wonderful human beings. And I feel this is true about my guest today, Dr. Alan Bauman, MD, who is an expert on hair restoration. He's a surgeon and has been practicing for 30 years. Anyways, we had this wonderful conversation where we talk about hair loss for sure, but women's hair loss and how it's different from men's. What causes hair loss for women? Are hormones involved? How does menopause affect the hair follicle? And what we should do when we notice that maybe we're losing hair and what that looks like, what treatments are available. There's a whole restoration thing. There's a whole regeneration thing that we talk about when it comes to the treatment of hair loss. And he said to me, time equals follicles. So if you think that you may be noticing that you're losing hair, the sooner you get in to have an assessment, the better, because there are multiple things that can be done. It's not, we start out this conversation talking about hair transplants, but that's him giving me a history. But then he goes on to tell me all kinds of treatments that are available to us if we feel like we have lost hair or losing hair, or that the hair that we have is less youthful, if you will. Really interesting conversation. I just went downstairs for some water and said to my husband, I just got a master class in hairology. I learned a ton. What a great conversation. Allow me, please, to introduce my guest properly. Dr. Alan J. Bauman, MD, is an acclaimed board-certified hair restoration physician with over 28 years of experience in the medical field. He is the founder and CEO of Bauman Medical, an international leading treatment center. It is in the field of hair restoration. Dr. Bauman received his medical doctorate degree from New York Medical College in Valhalla, New York, and underwent internship and residency training in surgery at Beth Israel Medical Center and Mount Sinai Medical Center in Manhattan, before dedicating his expertise to the specialized fields of hair transplant surgery and the treatment of hair loss. With a particular focus on androgenic alopecia, or hereditary male or female pattern hair loss, Dr. Bauman has established himself as an authority in the industry. He has 34,000 patients treated, 12,000 hair transplant surgeries performed, and 12,000 PRP hair regrowth treatments administered. He is a frequently invited faculty member and guest expert at numerous international scientific meetings and live surgery workshops, and has been featured in hundreds of news stories in the media. Dr. Bauman is one of approximately 200 physicians worldwide to achieve the certification from the esteemed American Board of Hair Restoration Surgery. He was voted #1 top hair restoration surgeon in North America by Aesthetic Everything for the 7th consecutive year, top hair restoration surgeon of the decade, and received the 2022 Lifetime Achievement Award in hair restoration. He was also recognized by Forbes as one of the 10 CEOs transforming healthcare in America, included in the Ape to Gentleman's list of the world's best hair transplant doctors for 4 years straight. Now, At the end of the interview, Dr. Bauman says that for the whole time he's been doing his work, it's been almost a 50-50 split of him treating women as well as men. So this isn't just a conversation around men's hair loss. It's absolutely women's hair loss too, and how the female hormones affect the hair follicle and what we experience in terms of hair. We even got into a little bit of anthropology, which, guys, I love to talk a little anthropology. Anyways, it is my pleasure to bring to you this conversation with Dr. Alan J. Bauman, MD, and I hope you enjoy it as much as I enjoyed being a part of it. And in the meantime, here's a quick word from our sponsor. The AG1 you've all heard me talking about for so long just went through a major upgrade. AG1's next gen is here. It's the same single scoop once a day, but now it's clinically backed and formulated with more upgraded vitamins, minerals, and probiotics. The new next gen formula offers a more advanced, clinically backed formula that fills common nutrient gaps and supports gut health, all in the same easy once a day ritual. AG1 has been a game changer for my mornings. It sets the tone for my day, helps me feel my best, and like I'm taking care of my nutrient needs in one step. AG1's Next Gen includes 5 clinically studied probiotics and additional vitamins and minerals to support whole body health. Now clinically backed with an advanced formula, this is the perfect time to try AG1 if you haven't yet. I've been drinking AG1 daily for 6 years now, and I'm so happy to be partnering with them. Subscribe today and try the next gen of AG1. If you use my link, you'll also get a free bottle of AG D3K2, that's vitamin D3K2, an AG1 welcome kit, and 5 of the upgraded AG1 travel packs with your first order. So make sure to check out drinkag1.com. That's drinkag1.com/Fiona Lovely to get started with AG1's Next Gen and notice the benefits for yourself. That's drinkag1.com/Fiona Lovely. Dr. Alan Bauman, welcome to the Not Your Mother's Menopause podcast. It's lovely to have you today.
Thank you so much for having me. It's great to be here with you.
It's fantastic. We just had a little bit of a chat before we started the recording, and I find it so interesting that our generation, as I said to you, you don't look old enough to have done the work that you do for as long as you have. And isn't it fun to be part of a generation that is challenging what we've thought about aging and what it's like to have a certain kind of biology as we get older? Isn't it so fun to be part of that?
Absolutely. I've been fascinated with longevity, really, I think my entire life. I've always been interested in finding out from those who are over 100 years old, what their secret is.
Yeah.
And I guess what I figured out by just, having casual conversations with them is that I'm not sure if they're telling the truth or not, because it's always something like, well, I had the cigar and a glass of tequila or bourbon before bed, for the past 60 years, 70 years or something. But no, it's great. We were talking about the fact that I'd been a member of the American Academy of Anti-Aging since 1998. And so at the end of my medical school career, actually, a couple of years after my medical school and residency was completed, I joined the American Academy of Anti-Aging.
That's awesome.
So
And it must just have been nascent at that point. It wasn't very old, yes?
So yeah, it was a little controversial. Well, always the anti-aging field is always a bit controversial, and that's kind of some of the exciting part of it. But remember, in these early days, back in the 1990s, we didn't even have one shred, not even one published study that you could extend a lifespan. I'm talking about everything. I'm not talking about humans, even fruit flies. We didn't know it. We couldn't do it. And so that research came much later, literally like, maybe even almost 10 years later before we could repeatably extend lifespan in other organisms, and obviously, trying to judge that in humans can be difficult, but we know that there are quite a few number of publications out there. I think Walter Longo was one of the first when it came to biologic clocks and extending lifespan in a variety of organisms and things like that. So from yeasts to worms and insects and rodents and all that, we've kind of figured some of that out. And it is an exciting world, and I think a lot of it has to do with our mindset. And that was really, after you get past the cigars and bourbon discussion with the centenarians,
Yes.
usually it comes down to PMA, positive mental attitude, and
Hmm.
I think that really has a lot to do with it. So, yeah,
I
it's
love it.
exciting, and I mean, one of my mentors in longevity, Dave Asprey, wants to live to
Hmm.
180, and
Hmm.
I might be right there behind him. I don't know if it's 180, but we'll shoot for 150. Even President Xi says he's going to live to 150, so we'll see.
Oh, how fascinating. Well, okay, so 1998, correct me if I'm wrong, but I believe the genomic mapping had just finished around that time. Wasn't it 95 or 96, something like that?
Yes, so we didn't even get to that in medical school at all, to be honest.
Yes.
So, all of this, what we've been doing more recently, especially in terms of hair loss, looking at genetic pathways, metabolic pathways, even not just pharmacogenomics, but nutrigenomics, how your diet can affect your metabolism and so forth. All of that was just, it wasn't even thought of as a science. It just didn't even exist. And I don't remember how long it took them to map the DNA, to map the genome, but it was like, a gazillion years long project, right? And now today you can send it off with a cheek swab and get the results back in, a
Yes.
matter of a week or two, right?
And we've learned it didn't necessarily contain the information we were hoping it would contain, right? So, but
Right.
that's another conversation. Okay, through A4M,
Yeah.
I actually don't believe I've ever had anyone on the show that has been interviewed by Dr. Peter Attia, and I'm a huge fan, and I talk about his book and the Centenarian Decathlon quite a bit. But you were actually interviewed by him in the early days, you were telling me.
Yes. So Peter and I met at A4M. I think it was in 2016. That was the first time we had a chance to actually meet in person. We had spoken on the phone a number of times before that. And it just so happened that we were same place, same time. And he invited me to come on the podcast, which for him was a new bit of business, within the first couple dozen episodes. Number 42, if you go to the drive, you can check out,
Love it.
maybe you should, after you listen to this podcast, go back in time
So,
to 2016 and see
yes,
if some things are the same. Some things are the same. A lot of the technology has changed.
I would
So,
say.
but yeah, I would encourage people to always go back to some of that source material that I recorded with Peter. I don't think it was quite 3 hours long, but it was a long bit of business, and we had a great time
Yes,
chatting all things hair. And certainly, we refer a lot of patients back and forth together, and I've
amazing.
helped him out on some of his AMAs regarding hair loss, and his team is actually quite amazing.
I have no doubt that they would be
Yeah.
of the
Yep.
highest caliber for sure.
Yeah,
Okay,
they're amazing.
so you and Dave Asprey are going to show up at 180 going, this is how we can do it. And I am absolutely certain that you will have the best hair of anybody in the room because this is your specialty.
Yes. Yes. So I will try. I mean, I'm working against my own genetics. So I do have a lot of hair loss in the family. My dad had severe hair loss, total baldness by the time he was in his 30s. His dad never met the guy with hair. And my mom's dad also had some significant hair loss before he passed as well. So, I know I've been tracking my measurements. I know exactly how much hair I have in each zone. And I've been basically fighting like hell
Yeah.
for the past 25 years to try to keep my existing hair. And it's certainly, I love my hair. I grew it long when I was in medical school,
Yeah.
when I was playing bass guitar. And, I had a ponytail when I was making rounds in the hospital during those years. And, even when I cut my hair the day before graduation and my parents walked right by me, they didn't even recognize me. I still wish I had that long hair. During
Sure.
COVID, I tried to grow it back, but I do love the hair that I have, and I will fight, like I said, like hell to keep it.
I love it. I love it. So it's a personal thing for you. Tell us about your personal journey of becoming a hair restoration surgeon, an expert.
Yeah, so I don't think anybody wakes up and thinks, "Oh my God, I'm going to be a hair transplant surgeon." And certainly that was not me. Back in the early days, really before I could drive a car, I was thinking about medical school as an end part of the journey. And I guess if you went back in time and you asked my grandmother when she was alive, when did Alan decide he wanted to go to medical school? she probably would have said something like this: the day he was born. So it was a little bit preordained in my family that I was heading towards at least a
Mhm.
medical degree. And it was while I was a teenager, met a gentleman through, he was a close friend of the family who was a very prominent plastic surgeon on the Upper East Side of Manhattan. And he said, well, if you're thinking about going to medical school, you should come and watch me operate. I'm like, oh, wow, that sounds great. Because you couldn't, there's no YouTube, there's no Snapchat, there's no, even Discovery Channel wasn't that great. You couldn't see anything. In order to get behind the doors of the OR, you'd actually have to physically go there. And this is the first I'd heard that somebody actually could invite me. I guess I should back up. My dad is a dentist, but it never really struck me as something I wanted to do. But when I had the opportunity to go and watch him operate, it was a life-changing experience. I mean, we met in the lobby of Beth Israel Medical Center in New York in the early morning. My parents drove me there, and they dropped me off, and he took me down to the locker room, threw me on a set of scrubs, and he's brought me to the OR and said, stand here and on this little step stool over my shoulder, but don't touch anything blue, because obviously everything was sterile.
Sure.
And I watched him do multiple procedures. I'm pretty sure he skipped lunch that day, as he did most days. And I was like, oh my God, how many procedures can this guy do in a day? It was amazing. But what I learned is that that moment, I loved the operation. I loved the procedure, looked amazing. The things that he did, eyelid lifts, the nose job, the face lifts. I mean, all of the different things he did through the day. Each one was more interesting and more exciting to me than the next. The sights, the sounds, the OR, the anesthesia, the nurses circulating, everything was just so cool to me. I knew that that's what I wanted to do. And what solidified it is that afternoon, we went back to his office and I met his patients who were either in the recovery or had fully recovered, and they loved him. And so there was incredible amount of gratitude that I could see that they had for him. And many of them felt like their lives had been changed. And I just knew that plastic surgery was going to be the thing, cosmetic surgery. So that was kind of the direction. But it wasn't until I was later on in my career, through my internship and residency in general surgery, which is on the path to plastic surgery, did I find out about a hair transplants. Now, obviously, I knew about hair loss. I watched my dad struggle with his comb over and then eventually some topicals, eventually getting a hair piece and all of that business. Um, but I didn't really think about hair transplant as a procedure, or I had a preconception that it was like pluggy or painful or whatever. There was like, the coach of the Knicks at the time, Jeff Van Gundy, had hair plugs and it just looked terrible at that time. And so I never thought it was a viable solution until I met this patient who was basically in my on my schedule for the day, having some other type of procedure done in the hospital. And he had listed in his medical history that he had had a hair transplant. And so then I was like kind of fascinated because I met him and I couldn't tell that he had had a hair transplant. I didn't see any plugs or anything like that. And so we got into this conversation about the procedure that he had had and how he chose the surgeon. And he was just amazingly over the moon. The fact that I couldn't tell it was a hair transplant because he fooled the surgeon. And I was amazed in terms of the hearing him talk about the procedure and seeing the result of it, and just knowing, envisioning what he was describing as this single follicle implantation process to create something that looked totally normal and totally natural. So I'm like, huh, maybe I should look into that. And then the other thing he shared with me that day was how his life had changed, both socially and professionally. And so all of that kind of together, the interesting part about the surgery and then the life-changing part of it that he had described, his wife and kids and becoming the CEO of the company through working through this board of directors and all this. I mean, I was like, I got to learn at least how this process is done, and maybe I could add that to my general surgery or plastic surgery repertoire. And that led me down the path of interesting investigations through the library, through the textbooks, through the journal articles, and eventually to the different conferences, and eventually into the doctor's offices, the hair transplant surgeon offices, where I could actually see and or go to live surgery workshops and actually watch and help perform hair transplant surgery. So
Amazing.
once I got into it, I realized it had to be a clear focus. I did actually a 1 year fellowship in hair transplant surgery out on Long Island around that time. And after that, I knew that there was no going back to plastic surgery, that I just wanted to make this my sole practice and sole focus. And moved to Boca in 1997 and started the office, started the practice.
That's a good place to go if you're doing hair restoration, I figure. Smart
Well,
man.
I mean, it was actually encouraged by my mother-in-law who had moved to Boca and was remarried, and we were visiting her and her husband. My wife and I decided that we liked the idea of being close to her mom, and also the palm trees and the ocean breeze weren't too bad either. And
No,
so we decided to make the move down from New York
amazing.
City.
Amazing. Okay, I'm going to pick up on some threads that you just mentioned. First thing is sort of a technique thing. You mentioned a single follicle transplant. That's possible now. I only ever knew the ones that had multiple follicles in the plugs, I guess, is what I know.
Yes. So, quick history of hair transplants started out with the plug type procedures here in the United States, which you can imagine were those round circular items. Basically, a 4 millimeter punch graft is about the size of a pencil eraser. So, that diameter is pretty big and it had 30 or 40 hairs. And so, the old plugs from the 80s and even sometimes into the 90s looked very unusual. And that's where the hair plug terminology really got started. And eventually, surgeons decided instead of taking these the punches of hairs, which were quite large, eventually they started to take a strip harvest and taking a strip out of the back of the scalp and sewing
Mhm.
it shut as a surgical procedure, obviously. And then those strips were then dissected into individual grafts, which could contain as little as a single hair follicle, but often didn't. And so in the early days of that dissection, you could get also results that weren't so aesthetically pleasing and ones that still look kind of grafty looking. But what happened over the years, two things. Number one, surgeons started to appreciate angle, orientation, and position of hairs, and also natural hairline design work, like the hairline is
Mhm.
not a straight row across your head, like they believe in some countries. It's actually a curved item, and it has a variation in density as it goes across. And that's normal and natural, and that will keep it looking undetectably normal and natural. And you could do that with cut to size grafts, as I mentioned, just you could cut those under the microscope. But the next innovation is the individual extraction of the graft. So no scalpel, no stitches. Instead of taking a strip from the more permanent zones of the back of the scalp, we can now take each individual graft one at a time, as little as a single hair one at a time. So that's a much less invasive procedure that heals much quicker with less downtime. And that gives us maybe a little slower process, but that gives us the grafts that we can now implant into the thinning or the balding areas. So a hair
Okay.
transplant is basically moving hair follicles, which are the
Yes.
action item, right? That's
Yeah.
the organ that makes the hair from the more permanent zones around the sides and the back. That's true in both men and women.
Okay.
And into appropriate areas, which are, let's just say, less dense than they should be. But hair loss has a kind of a long span of progression. So you can go from good thick density to weaker, wispier hairs before you start to deplete the density, and either receding hairline or diffuse hair loss occurs. So there's a lot of in between. But hair transplants today are amazing technology. It's a symphony of detail. One of my colleagues calls it the most sophisticated and labor intensive, labor of love plastic surgery or cosmetic surgery procedure on the planet. And that's because it typically takes about 20 man hours of work to complete a single day of hair transplant surgery. So that means multiple people kind of working together in
Yes.
different phases, obviously,
Sure.
of the process to execute the procedure. But the end result is what we want it to be is youthful, natural, and undetectable uh, over time. So that's what single follicle implantation or extraction of single follicular units enables us to do.
Amazing. Amazing. Define permanent zone for me.
Yeah.
What is
So
that?
think about male pattern hair loss for a moment before we go into female pattern. Male pattern hair loss obviously starts with a receding hairline, continues with balding in the crown usually, and then you lose all the hair on the top of your head. And most people know a male or in their life who has some degree of male pattern baldness. 20% of men in their 20s have visible signs, 30% of men in their 30s. By the time you get to 50% of men have visible hair loss. And of course, it goes up and onward from there. But male pattern hair loss does not affect the area around the sides and the back of the scalp. So
Ah,
if you see someone who's totally bald, either they have an autoimmune condition, they're dying of starvation, or they're under cancer treatment, or they have shaved that area. So those are the
okay.
possibilities. But usually men, like my dad, when he was wearing a hair system, he had hair around the sides and the back, but had no hair around the top of the scalp. And so the permanent zone is that area in the back of the scalp. That those areas are immune to androgens, which are the
Mhm,
male hormones that
mhm.
trigger that miniaturization that progresses through the natural zones of male pattern hair loss. Now, in
Okay,
women, it's a little bit different.
fascinating. My dad was also someone that had hair loss, and I always
Uh-huh.
referred to his hair as the cheeky kid as the cul-de-sac of hair because it was just that bit around the outside. And he had a few wispy bits, and my grandfather had the full comb over. There was a few times where he'd be out in the
Hmm.
wind and it would come unglued down and it'd be flying out over here. I know you know what I'm talking about.
Sure. Oh, 100%.
Okay, so
100%.
let's talk about women's how hair loss affects women and female
Yeah.
pattern baldness, did you say?
So female pattern baldness also hereditary. So you can get it from your mom's side or dad's side. It's probably same kind of androgen sensitivity, but it starts differently. It looks different. So remember what I said in men, the receding hairline is first. Actually, in women, that typically happens much later on. The first thing that will happen in women is they lose a diffuse amount of density in that frontal zone. So the types of changes that women will normally see first is changes in their hair volume or a widening part line or some shorter hairs. They might think it's breakage, which could be, but it could also be from the miniaturization of the hair follicles as well. And difficulty styling, like they just see some more scalp shining through. Overall, their hair changes texture. It can also change in color, obviously. And eventually, it can also recede away from the forehead. And usually that's because these areas in the temples start out with a little bit less hair. So as they start to degrade in terms of density, all of a sudden the forehead looks wider and larger. And that's obviously not a desirable look. If you can
Mhm,
cover it with your existing hair, great. But if not, it looks going to look more masculine and it's going to look a lot less youthful. So that's not such a good thing.
mhm.
So, and I think there's also the fact that in women, their hair, what I found in my practice is that female hair follicles are a lot more sensitive to all of the other things that happen in our lifestyle, including hormones and our
Mhm.
diet and stress level and inflammation and everything else that you could possibly imagine. It dysregulates the hair follicle to a much greater degree than in men.
Interesting. Okay, miniaturization. Let's talk
Yeah.
about that. Break that down for me, please.
So miniaturization is exactly what happens in male and female pattern hair loss because over time, the first of all, let's talk about the follicle, natural follicle growth cycles. So a hair follicle, again, is that action item. It's the mini organ under the skin. You're born with about 150,000 of them front to back if you have a healthy head of hair. About 85% of them are in a growing phase at any given time. And the other follicles are in a resting phase. And so hair follicles normally, naturally cycle through a growing phase, which could last about 5 to 7 years, which gives you, shoulder length hair, or ponytail, right? And then they will turn off and rest for about 90 days as you go from anagen to catagen, which is the degradation phase, to telogen, which is the shedding. The new anagen follows right behind. So think about the follicle basically working for 5 to 7 years like a 3D printer, making that long, beautiful hair fiber of dead keratinized tissue. And then it takes a rest. So it's vacation and rebooting for about 90 days, and then it turns on again. And it really should not necessarily, for most men and women, it's not a synchronized shedding like in the animal kingdom, where at the end of the winter you get a shed of hair. Usually, it's not like that in humans. Well, it could be, but not usually like that. And so it's random. Some hairs are turning off and turning on any given day. And shedding occurs in about should occur at a rate of about 100 to 200 hairs per day. And the longer your hair is and the curlier it is, the more of that hair you're going to see kind of getting caught in the shower drain or even in the bed sheets and so forth or in your brush.
Mhm.
Now, that's normal. So 100 to 200 hairs a day, not a big deal. But if you start to shed more than that, then that could be a sign that something's going on. But when it comes to male and female pattern hair loss, the follicles are typically not just turned off and that's the end of it. That's not how that works. The follicles will weaken. So they'll grow a shorter hair with each cycle, and the hair will get thinner and weaker and wispier with each cycle and less pigmented. So there's this span of time where you go from basically like an oak tree to a birch tree to a blade of grass. And at some point, that blade of grass cannot be rejuvenated, and that's important to note. So there's usually a lot of in between. If there's hairs that are weak but not dead, we can intervene and we can hopefully do something to regenerate or rejuvenate that hair follicle.
Okay, let's talk about that because I can see that's the place you want to step in to try to interrupt that process and maybe reverse it back up to the oak tree. But before, I've just got something niggling in my consciousness that I have to ask. I always want to know why. And so my question to you is, do you have any idea why evolutionarily it would make sense for us to have hormonally responsive hairs in this bit right here, whereas these ones are not responsive? Any thoughts?
Well, the main reason is so that I will have a job. No, I'm just teasing you. This, no, the real reason is, I believe, is that hair, of course, it's very valuable. Everybody wants a beautiful head of hair. Well, why is it like that? Why do we value that as a species? When you look at someone, even you haven't even seen them turn around, you just look at them from behind and you see they have a beautiful, thick, full, healthy head of hair. Why does that trigger something in most people's brains? And I think it's because the hair follicle is a highly sensitive organ to our nutritional status, our genetics, inflammation, our nutrition, all of that.
Mhm.
It's basically like I said, it's a 3D printer, but it's a constant output of how we're doing. And so as we continue to age, it would be interesting to have, and Mother Nature designed us this way for better or for worse, a biologic clock that's visible from the outside to help us determine, let's call it 1 million years ago, we're in a caveman situation in the cave, caveman, cavewoman sitting by the campfire they want to make a split-second decision of whether they can procreate the species. You
Yeah.
want to have a very quick way to determine if that person is youthful and vital and fertile. And I think
Okay.
that that's why we have androgenic alopecia, which is basically the chronic and progressive condition of hair loss in not all men and women, but many, right? Most.
Interesting. Okay.
Right. So
Yeah.
just like our skin ages with
Yeah.
time, right? We're going to try to prevent that if we can. Our brain ages with time, our muscles age, our bones age, our cartilage ages. The outward sign that we are
Mhm.
healthy from the inside out. I'm not saying all the time because there's autoimmune conditions that could, disrupt your hair follicle, but you could be totally fit and healthy inside. So it's not
Mhm.
an exact match. And so, of course,
That's a good
evolutionarily,
guess.
it's not perfect measure of what's going on, but it gives you at least a hint,
Yeah.
right? And
Yes.
so I think
Okay.
that's, just like think of it like a male bird with the plumage, right? The colors. The
Yep.
female has duller colors, but she's looking at the male and going, okay, she's making a split decision in her bird
Yeah.
brain that, okay, he's got good color, it looks fluffy or whatever. He must be, well nourished and got good genetics and blah blah blah. So
Yeah.
that's what I think.
Oh, I'm picking that guy over there because he's got the nicest plume I've ever seen. I get it.
Right.
I totally get it.
Today, yeah, today it's a sports car, but no,
Yeah.
I'm just saying, I'm just I'm
That's
just teasing.
awesome. Okay, so let's talk about this.
It's probably the source of today's problems in
Yeah,
society
I
that we're
know, right? Like,
making a judgment call on the wrong things, but that's okay.
it's
Neither
it's
here nor
true.
there.
Yes, it's true. Are we
No, but
going with?
that's why. But think about this. I mean,
Yep.
just one more thing. So on the
Yeah,
female side, because I do have to flip it around.
please.
So obviously, men see a woman with good curves. We'll just leave it there. Hips, obviously, the birthing channel.
Yeah.
Obviously, that has a certain resonance, if you will, in our lizard brain. That
Yes.
that 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 woman might be good at procreating, and
Yes.
and it's obviously not just her shape, but how she moves and
Yep.
so forth. And
Yep.
will she be able to lactate and feed the kids? Those are
Yep.
things that we don't consciously think of,
No,
but a head of hair is kind of like in that same part of the lizard brain back there, start
that's
under
true.
under
That's
there.
true. Interestingly enough, I have my bachelor's degree is in anthropology, and my mother used to say to me, You're never going to use that for anything. Why are you studying that? I use it all the time in my work. And this is part of the reason I want to know the why. What is the evolution behind that? Why did we evolve to have that kind of characteristic? Anyways, let's go back to oak tree versus grass, blade of grass.
Yeah.
That's a different color. So this is the place you step in and there are options in terms of how we can restore the follicle. Does it work like that?
Yes, absolutely. So it begins with an evaluation process. And of course, in medicine, evaluations don't just mean like, oh, we're touching, looking, and, examining right off the bat. We're talking first, obviously. And I'm very traditionally trained. New York Medical College taught me that 85% of the diagnosis is received from the medical history, right? Before you even get to the physical exam. So we're talking a lot about what's going on. Of course, that conversation might involve what's your family tree look like? Your biological blood relatives, do they have male or female pattern hair loss? What is the quality, color, and curl of their hair and their hair patterns and so forth? But most importantly, I think it's critical that if you believe that you're at risk for hair loss, you should get evaluated sooner rather than later. And this is kind of like just one of those take-home messages that every listener should kind of file in their brain as like, this is an important point, that time equals follicles. Because if you wait, if you're in denial that something is happening, you may lose the opportunity to protect those hairs before they're over the cliff, dead and gone, so to speak. So, time is follicles. We say time equals follicles because hair loss is chronic and progressive, and it doesn't get better on its own typically without treatment. So, but let's go back. So we're going to do this evaluation. We're going to ask our patients about their lifestyle factors. How's your nutrition? Are you on a specific kind of diet? Do you have? Are you prone to inflammation, or are you allergic to anything? Do you have poor absorption in the gut? Are you appropriately nourished with protein? This is very important. Are you on any special or restrictive diets? Have you recently been sick? Have you had high fever? Have you been hospitalized? Have you been under general anesthesia? Have you had an infection or an abscess in your tooth or something that's been handled recently? How is your sleep cycle going? What is your stress level and stress management skills? We all experience stress every single day. It's a survival mechanism. But if you're not supposed to be exposed to cortisol all the way through, have you had blood work done? Are your hormones in balance or not? Are they normal according to the blood levels, or are they optimal? Right. And, we can do deeper dives into exactly what's going on in the DNA. So we can determine, are there things that might be making you more prone to poor circulation or poor collagen or production in the skin, for example, which are critical for hair. So there's a whole bunch of discussion that goes on are you on special medications? Things
Mhm.
like blood pressure medications, statin medications, mood stabilizers, weight loss drugs, even thyroid replacement. All of those are not great for hair because they can impact the way that the hair follicle functions.
Mhm.
So there's a lot going on in that to unpack in that
Yeah.
discussion. But then we're going to get to the hair follicle. We're going to basically take a look at your scalp first. So the scalp, is it healthy? Is it inflamed? Is it itchy, dry, oily? Is there extra blood flow, circulation, or extra blood vessels that we see under the skin? Is it intact? Is there an ulceration? Is there a buildup of skin cells? Is there excessive oil? Is there psoriasis? Is there other things that are inflamed, let's say? Is it the correct color? Does it look like it's scarred or damaged from an injury or exposure to chemicals over time? Things like
So
that.
many factors.
Right. So lots of factors. And then that's not even looking at the hair. And then of course, we're looking at the hair density. So we snap a photo microscopically. That's called using a trichoscope, which looks at the hair, right? Trichoscopy is now electronic and digital and AI powered. So it'll give us a hair count and each different zone. So the more permanent zones are compared to the areas that are at risk, maybe the temples or the front. And it will not only measure the numbers of hairs per square centimeter, but also give us the quality of the hair. So every single hair in the photo is tracked in terms of its thickness. So is it a 30 micron hair? Is it a 50 micron hair? Is it a 90 micron hair? That's the range.
Hmm.
And you could have a mix of different types of hairs. And then, of course, we're going to look and touch and feel, does the hair appear dry, damaged, broken, colored? Are the ends split? Are there hairs of all different lengths? Are they all the same length? Does the hair look shiny or smooth or Is there something else going on? Do we see scalp shining through? And so then we talk about how to keep the scalp healthy, and then the interventions that we can use to get the existing hair follicles to grow thicker, better, stronger.
Oh, and it seems to me as you're describing this, first of all, you sound more like internal medicine or integrative medicine, asking all these questions about lifestyle and nutrition, and I love it. It's so good. This is the way it should
Yeah, if
be.
your internal medicine doctor is asking you those questions, you've got a pretty good one because a lot of them don't even ask that. No, I would say we take a more functional approach. Just if
Yes,
you were, I was going to categorize it, you know, a
important.
holistic or functional approach, because
Mhm.
each one of those different things is like a warning sign or a ding in the armor, a chink in the armor, so to
Yeah.
speak, when it
Mhm.
comes to optimizing the function of those
Mhm.
hair follicles. You
Mhm.
could put all of the latest and greatest medical therapies into your scalp for hair regrowth. But if you're protein deficient, you can basically forget about it. It's as
Interesting.
simple as that. That's just one little thing, right? And so if you don't have good blood flow to the skin, let's say you're a little bit anemic,
Mhm.
that's going to hold back your hair regrowth potential.
Now, you
So
and I
all
know
of that
this.
needs to be chatted about.
There's a lot of women that are anemic and don't even know it. You and I know that
Oh,
a lot.
for sure.
We see it tons. Um, and I would love to see sort of medicine treating that a little more seriously than, oh, you've just had a baby, don't worry about it, you'll be fine. You know, you won't sleep for the
Mm.
next 2 years, but your body will figure it out. Anyways, that's beside the point. You know what I'm saying?
Oh,
So,
100%.
yes.
100%.
Yeah, it's
You
it
know,
that one is one we see so commonly. Okay. A couple of things that I want to pick up here. Something you said before we started talking was that the hair follicle itself is very responsive to hormones. And this is a very relevant conversation for women in perimenopause and menopause.
Mm.
Can you talk about that a little more, please?
Sure, absolutely. So, male and female pattern hair loss is called androgenic alopecia, and it's called that for a reason. For example, in men, we know specifically exactly the hormone that triggers the miniaturization of the hair follicle. And that is a metabolite of testosterone called DHT, dihydrotestosterone. And as you know, men and women all have testosterone. Um, and all men and women have DHT, obviously just different levels and different levels of sensitivity, honestly. So you could have super high testosterone and super high DHT, but if you're not sensitive, then you're not going to go bald. And so that's why there's a variation between siblings, for example, who
Mhm.
may have similar hormonal profiles, but one sister is very, very thin or weaker haired, and then the other one has thicker, stronger, healthier hair. So the androgen DHT, we know, is a specific detrimental trigger for the hair loss, right? So we know the DHT basically, for whatever reason, degrades the quality of the hair. We know that specifically for men very clearly through blocking DHT, inhibiting DHT production. It's very simple. If you take DHT production down 60 to 70% of normal, you get a 90% chance that you will keep your hair. That's pretty good. And a 2 out of 3 regrowth in men. So it's very clear that DHT has a prominent role. And if you lower the DHT even further in men, you get even a better response and faster response on the hair. Now, in women, it's a little bit more confusing because the original studies that were done in blocking DHT, for example, in postmenopausal women, basically came out 50-50. But what that tells us is that they didn't really separate out those women who were likely to have a good response. And they also didn't screen the women for all those other things, those other lifestyle factors that we just talked about. So that means that 50% of the women that come into my practice, if we just focused on androgens alone, not enough, right? 50% of them are not going to get a response. We got to do other things. So when hormone levels change, and you guys know this better than anybody, whether it be after childbirth, right? So you have all the hormones that are raging, childbirth within 24 hours. This is what I know. The
Mhm.
hormones go back to the to baseline.
Mhm.
Within about 6 weeks, boom, you get a massive synchronized shed most of the time. And
Wow.
especially in women who are hormonally sensitive in terms of their hair.
Mhm.
And
Mhm.
so if that's happened to someone out there, what we find is that that makes them a lot more likely to experience um, hereditary androgenetic alopecia later on when they go through perimenopause or menopause. Now, it doesn't always happen. We have many patients that have a lot of hair loss for a lot of other reasons other than menopause and perimenopause. But certainly, as you can imagine, as hormone levels shift and also ratios, whether it be progesterone and estrogen, the female hormones to the androgens, as all those levels start to shift, then you can certainly still see that androgenic alopecia kind of reveal itself.
Interesting. So, this is a very common thing to happen for women at perimenopause is that we can experience the hair loss.
Oh my God. Yeah. So it's a
Yeah.
super common sign.
And I remember my hairdresser saying to me a few years ago, she's like, she was working away on my hair and she kind of went, hmm. I'm like, what's going on? She tapped this spot right here and said, yeah, how's the perimenopause coming along? I'm like, well, shit, I didn't
Uh-oh.
expect to see that one coming today, but
From your hairstyles. Wow.
yeah,
The other thing that we see, and I have to finish up this part of the conversation because
please.
it's really important. Um, Hormone optimization in
Mhm,
women is so important today, obviously
mhm,
gaining more traction because we're
mhm,
putting to bed all of the myths and the misconceptions and all the nonsense that's been, pushed out through the medical community for 20 years, I guess. Now we're seeing more aggressive hormone optimization, especially those who are in the know.
mhm,
And the OBGYNs who are now getting on board with trying to regulate it. But more importantly, I would say the longevity and hormone optimization specialists who've been doing this already for 20
mhm,
years are the people to
mhm,
seek out. But when you go on testosterone as a woman, they have all the great benefits: lean muscle mass, libido, mood, all of these great effects. But many times, if it's overdone, you're going to see that aggressive progression of female pattern hair loss. And unfortunately, this is a side effect that many hormone specialists are not familiar with.
mhm,
And what happens is that they don't screen their patients for androgenic alopecia or female pattern hair loss before they get started on the hormone replacement therapy. And then all of a sudden, 6 months later, it's like, what's going on? Why am I receding so badly? And so it's a very, very common accelerator of the female pattern hair loss. They may still have gotten to the same place over the next 10 years, but they got there faster because of the extra testosterone. So we need to think about anti-androgen therapy or maybe pulling back on the testosterone a little bit to see if we can, cut down the amount and still get great results on the symptoms and all the great things that we want to benefit our patients with.
So for the anti-androgen component of this, I
Mhm.
recommend saw palmetto for my patients that are taking that. Now that's a start, but are there other things that we can do for that? And what are your
Absolutely.
thoughts on saw palmetto?
Yeah, so I'm a huge advocate for saw palmetto.
Okay.
It is an herbal treatment that's been around for, I don't know, 1,000 years. It is an anti-androgen, as you say. I'm not so sure we know exactly what the mechanism is, but it's been used and tested and tried in prostate conditions in men. And so I'm not against it at all. In fact, we're very big proponents of saw palmetto. And there's other mushroom components which can work as DHT inhibitors as well.
Say
The
more.
name. The names escape me, but I can look it up for you. In fact, yeah, we can find out some of that to put in the
Okay.
show notes if you would like.
Please.
On
Yes,
the
please.
pharmaceutical side,
Yes.
um, dermatologists have been using spironolactone for many, many years to combat acne, which is also an androgen sensitivity issue
Hmm.
to some degree. In the skin, obviously, as well as the scalp. So
Hmm.
that is something that we can also prescribe. A lot of dermatologists used to prescribe, for example, the old minoxidil topicals with the spironolactone at the same time. Spironolactone does kind of double duty as a diuretic as well as an anti-androgen. So you just have to be careful. If you're really increasing the dose of the spironolactone, then you've got to be careful not become dehydrated or loss of electrolytes. PCOS patients, polycystic ovarian syndrome, obviously one of the most common, actually the
Hmm.
most common hormone abnormality, women of childbearing age are often treated with spironolactone and a number of other things. And they actually have a lot of androgen sensitivity symptoms and signs, the acne, hair loss, all that comes along with it, in addition to the weight gain, inflammation, and things like that. On the pharmaceutical side of things, more aggressively, as we get into menopause, I would also recommend looking into finasteride or dutasteride. Those are the primary antiandrogens that we use in men. We don't necessarily recommend those in women. First of all, they're off label completely, not approved for women. It's just put that asterisk in there. Um, And the main reason is because women of childbearing age, if they were to go on an anti-androgen therapy like finasteride, there's a theoretical risk that if they were to bear a male fetus in the womb, that there could be a potential for side effects to the secondary male sex characteristics. So that's never happened actually in real life, but it is a theoretical risk, and so we do not prescribe finasteride or dutasteride to women who are of childbearing age.
Mm.
We would do that
It's
with caution. So.
it's a
Um,
terrifying enough thing that could happen. We do not need to have a whole
Yeah, I
generation,
mean,
right?
correct, correct. So we don't go that direction, but postmenopausally, obviously, or if the woman's had a hysterectomy, surgical menopause, no problem. We can go forward with the anti-androgens. And as I mentioned,
Okay.
the data is actually pretty good for androgenic alopecia and finasteride. About 50% of those women get a good response from just the finasteride alone.
Oh,
But then we
interesting.
start to add other things. We can add other things into the mix. So I had mentioned topical minoxidil in the form
Yes,
of
you
Rogaine was
should.
the first
Yep.
FDA-approved medication for men, and then it was approved in women, and then 2%, 5%, and so forth. But today we can compound that into an oral tablet or capsule. So
Okay.
oral capsules of minoxidil can be
Mhm.
very safe and effective when dosed appropriately. And
Okay.
that's another quick asterisk there that we want to make sure that we don't overdose anybody on minoxidil, because
Hmm.
minoxidil can have very serious systemic effects if dosed improperly. It can reduce your blood pressure to the point of dizziness or headaches. It could cause water retention. It can cause a higher heart rate. So we want to make sure we microdose that minoxidil, or just keep it totally safe. Let's use a topical in conjunction with it.
Ladies, can we talk about energy for a minute? I know so many of you tell me you're trying everything, the supplements, the workouts, the sleep hacks, but you're still feeling tired, foggy, or just off. I get it because I've been there too. Here's what I've learned: true energy starts way deeper than we think, it starts in our cells. And as we navigate perimenopause and menopause, our cellular energy naturally declines. That's where Timeline's MitoPure gummies come in. These are the first ever longevity gummies powered by MitoPure, the only clinically proven form of urolithin A. What I love about them is that they're not just another supplement promising a quick fix. They actually work at the cellular level to improve your energy at the source and help with strength and endurance. In clinical studies, they increased muscle strength by up to 12% after just 16 weeks. Urolithin A works at the cellular level to improve energy at the source by transforming cellular damage and targeting a key hallmark of aging, helping to give you sustained energy to feel like yourself again. It's recharging your cellular batteries to combat the natural decline in energy production that happens as we age. These gummies are a game changer. They're sugar free, naturally sweetened, and actually taste good. I keep mine right on my bathroom vanity so I remember to take them every morning. If you want to feel like yourself again and stay strong as you age, you need to try MitoPure gummies. My friends at Timeline are offering 20% off just for the listeners of the Not Your Mother's Menopause podcast. Head to timeline.com/lovely20 to get started. That's timeline.com/lovely20. Your cells will thank you.
And by the
Okay,
way, we
so
can use both minoxidil and finasteride both topically and orally in postmenopausal women.
lots of things that can be done prior to actually having a follicular transplant, as we talked about.
Well, we're not even done, because
Ah,
we didn't even talk about regenerative medicine, platelet-rich plasma, the use
okay,
of
let's
growth factors and peptides, FDA-approved
exosomes, let's
lasers, laser light
PRP.
therapy.
Yes.
Yeah.
Okay, let's go there, but let me ask you a question about minoxidil before we move away from that.
Okay.
TikTok would have me believe that the men's version of minoxidil OTC at 5% gives a better outcome for women than the women's version at 2%. Now, there's a whole lot of BS science in there, or, TikTok science. So, can we talk about that, please?
Yeah, so I think now the 5% is actually FDA approved for women now, I believe. But, look, we haven't prescribed over-the-counter minoxidil in a long time in my practice. The main problem with over-the-counter minoxidil, number one, the vehicle. So whether it's the liquid or the foam, it's a little bit messy and very often irritating to the skin, and certainly almost always disastrous to your hairstyle. So a compounded
That's
version.
important. That's
Well,
important.
listen, I've treated 35, almost 35,000 patients. I can tell you, I can have a miracle, but if you don't do it and you don't do it properly, it's not going to work, right?
Yeah.
So it's like telling somebody go do 50 push-ups. If they don't going to do the push-ups, it's not going to work,
No.
right? So we have to make sure that no matter what we recommend, that it's actually able to be done. And it's easy to say go to the supermarket and get yourself some topical minoxidil, Rogaine or generic or whatever, but 30% of the people are not actually genetically um, benefiting from over-the-counter minoxidil because they don't have the enzyme to convert it into minoxidil sulfate, or it's a very low activity. So
Interesting.
35% of the people right off the bat who are not using a prescription version are never going to get the results that they could have. And then the other big portion is that the fact that you're going to put it on your scalp and you're going to get it all over your hair. And it's going to make your hairstyle a disaster. And so you're not going to do it in the
Yeah.
morning, but certainly not before you go out to work or
No.
play. And
No.
so maybe you'll do it at night before bed, but not in the morning. And minoxidil only lasts in the body a certain amount of time before it gets metabolized and excreted. So if you're not doing minoxidil twice a day on the scalp, you basically got a D minus on your report card for hair homework. That's not good.
Oh no, no. And can I say that if I don't care how miraculous it is, if it's going to mess my hairstyle, forget it. Forget it. It's not happening.
Right. So propylene glycol is the vehicle of minoxidil in the over-the-counter solutions, and that can be very, very irritating to the skin. That was the original, the OG back like 40 years ago. That was the only thing they dissolved it in is an alcohol because of the way that if the minoxidil is an organic compound, it only dissolves basically in an alcohol. Propylene glycol is a nasty ingredient. It's terrible. So what do we have instead? Formula 82M is our basic compounded minoxidil. It's got a proprietary base. I didn't invent it, but some very smart people did. And it's non-irritating, it's quick drying, it's fast absorbing, and it also contains, in addition to the minoxidil, it contains this tretinoin, which helps penetrate the minoxidil into the skin and also helps activate the skin to actually use the minoxidil better. So you get a much better response in those patients. And it also has a mild anti-inflammatory built in. So Formula 82M, that's a proprietary compounded pharmaceutical version that your doctor has to write for specifically. And it can only come from two pharmacies in North America, one in
Oh,
Canada and one in the United States. And that's it.
okay.
But
So,
you can also get 80, so that's 82M, there's 82F, which contains minoxidil and finasteride, and there's also 82D, which is minoxidil and dutasteride.
okay, interesting. Um, so I happen to be in Canada. Most of my listeners are in the
Oh,
United States, though. So if I go to my because we are not all in Boca Raton that we can come and see you. So if there's somebody in our, can we go to our dermatologist and ask them to do a compounded version of that? Is it as simple as that?
well, that dermatologist would have to have I don't know how it works in Canada, but they'd have to have a relationship with Pure Pharmacy. I believe Pure
Yeah,
is the
okay.
pharmacy in, I think they're based in Vancouver,
Okay.
that has the Formula 82, I don't know, let's call it license, right? That labels
Yeah.
them to make that formula. It's not, to a regular pharmacist, from what I understand, and I'm not a pharmacist, it's not self-evident like how to make this. That's the other thing. Everybody today, there's a zillion different formulas. Oh, it's got this percent and that ingredient. It's got some magical eyelash growth treatment mixed in with the hair growth treatment and all that. And it's got some rosemary oil. And, but the bottom, you can get very clever with the compound.
Hmm.
But the question that nobody asks is what is it mixed into? What
Okay.
is the vehicle? And the vehicle is how it feels and how it activates on your scalp. And so it's like a tricky component that's not listed in your pharmacy. Well, what is the vehicle? They don't tell you what the vehicle is, but the vehicle is the most important ingredient because
Interesting.
the minoxidil is cheap. The vehicle is not.
Okay.
Does that make
Okay.
sense? That the
Well,
vehicle is like, that's
oh
like the
yes,
thing.
it does. It does. So Are we still feeling like women are better off with 2% versus
No.
5%?
Okay. So yeah, I kind of, I went a long way around your
Oh,
question.
good.
The stronger, the better. 5%, please.
Okay. All right. So the ladies
So
don't need to have the light version. That's nice.
no, 82M, which is
Okay.
the formula 82M
Yep.
compounded medication, it's 5% minoxidil.
5% minoxidil.
Yeah.
Okay. Interesting. All right. So other
Twice a day.
treatments. But right, right, absolutely. And it's less likely to mess with your hairstyle if you've got the compounded version with the formula 82M. Yes?
Right. And you part the hair, get it
Yep.
down onto the scalp. Don't get it all. It's not a hair product. You're not putting it on your hair. You're
Right.
putting it down into the skin.
Yes. Yes. Makes
Really
sense.
important. Really
I
important.
actually saw somebody do this recently on social media where they actually had their hair pulled back into a ponytail so that they could get into the areas on the side, which was easier than trying to
Mhm.
navigate the hair itself, which I'm sure you've heard that one before.
Yeah, navigating your hair is not simple. In fact, it's not even easy for hair surgeons to learn how to navigate the hair sometimes. It's one of the things that we teach and train our fellows, like how to manage, how to get whatever we're doing into the skin, right?
Yeah.
So we actually have a video on like how to apply 82M, and it just teaches you how to apply it directly to the scalp in the correct volume and the correct locations, at least as a starter. It's a primer, right? And then after you've mastered the volume that you need to apply each day, let's call it 30 drops, twice a day, then you want to kind of work it around and do that same volume, but in a different pattern. So instead of making your part lines this way, make the part lines across instead
Mm,
of down, up and down. So just a
interesting.
little tip and trick for your audience there.
I like it. I like it. I use a hyaluronic acid serum on my scalp, so I have some experience
Nice.
playing getting in there and but it's a learning curve for sure. You just, you got to figure out where to put the where you get it in. And you don't do it
100%.
right, then it does get all in your hair. Okay, so let's talk
Exactly.
about the other things that you mentioned, the PRP, the red light therapy, the exosomes. Like what
Mm.
else have we got going on in hair restoration?
So, in your hair homework category, I would still include an at-home laser light device. So, the Bauman Turbo Laser Cap has the most number of diodes with 25% more coverage. It covers from the nape of the neck all the way through the temples in a device that's completely portable. It means it packs flat for travel, collapses, and then when you're ready to use it, it turns into a dome, and then you can use it on your scalp. 5 minutes only per day, and that delivers FDA approved hair regrowth, low level laser light therapy, or what's called today photobiomodulation. So, that's where that's the word salad, but that's
Word
what you need
salad.
to. But just
Yeah.
be aware that in the 15 or whatever 20 years that we've had low level laser light therapy available, now the market is saturated with watered down consumer devices, of which many do not even contain real lasers. So think about this for a moment. You have a device that I've just mentioned, a medical grade device that has over 300 pure lasers that are specifically angled and tuned and focused to give you maximum cell coverage. Now, if you went to China and you built a knockoff version of that, you'd create a dome with little light bulbs in it that just have little red blinkies. Okay, you're not going to get the same. And you wonder why that device costs $500 and the
Mhm.
real device costs $5,000.
Mhm.
That's the Timu version.
Yeah.
Okay, so that's what you're seeing on Amazon are the
Yeah.
Chinese knockoffs, and they sound great. They have great testimonials. They have great photography. They have great
Mhm.
marketing behind them because it's big business. But just like buying a TV, you can walk into Best Buy or whatever your local TV provider is. You know the difference between a $5,000 TV and a $500 TV very clearly when you stand
Mhm.
next to them, put them both together. The features, the functions, the pixels, the diet, whatever, very different. Same thing with laser devices. So if you're going to go get a laser device, get a medical grade version from a board certified hair restoration physician. This is not the time to cheap out on Amazon because overall, even if you buy the most expensive one that you can find from your hair doctor, like we have ours is the top of the line, it's still your least costly treatment over time
Mhm.
compared to other therapies that you do. So that's my spiel on low level laser light therapy. Have you ever seen a turbo laser?
Now, have you got one there with? Yes, please. Let's have a look.
So this is
Wow.
what this is a demo version actually, but this is the turbo laser. But you can still see it's
Yeah.
flexible and portable. When you take off this little strap in the front,
Yes.
okay, it collapses into a flat item like this.
Okay.
So you can see these are all little laser embedded in the device. And when you're ready to use it, if you've just traveled with it, you take it out of your backpack or out of your suitcase and you just snap it together like this and you're off and running, ready to go.
Amazing. How many times a day do you use that?
I use mine 5 minutes a day, and that's what's
Okay.
recommended. Now, some people during a healing phase after a hair transplant, they may use it longer, maybe twice a day. But 5 minutes a day is what the clinical trial research, published research shows is good for hair regrowth.
Okay, amazing. And we'll make sure to leave where people can find more information on that on your laser device, especially if it's the top of the line one, because that's what we
Yeah,
want. We want
this
things
is
to be effective.
award-winning Bauman Turbo Laser Cap. It got a
Amazing.
hair restoration innovation award from Ask Men.
Okay.
It's been featured on the Today Show. We've had it on the Doctors. We've had it on a number of different places. It was also featured in Rob Report, if
Okay.
you like the bougie magazines. But this is the latest and greatest. The most well-engineered at home laser device on the planet.
Okay. And so what is it doing to the scalp?
Oh, wow, great question. So, red light therapy, years and years ago, you know what? I must have missed that class in medical school. How come they didn't teach us what red light does to the
They
skin?
did
I don't
not.
understand. In the 1990s, no, they didn't. I missed that class. I took the one on photosynthesis. I think it was biology in college.
Uh-huh.
But no, here's the thing. So today we know this particular wavelength of light, which is visible red. So, of course, you've heard of far infrared sauna and near infrared for brain function. This is pure visible red. Visible red is absorbed at the level of the mitochondria. And at the level of the mitochondria, which are the energy centers within the cells, they create ATP. That's what mitochondria do. They turn stuff into energy. And that's why they became, like, let's say, a vestigial part of the cells. They were probably invited into the basement here. So, hey, if you're going to come live with us, and you better make some energy and we'll protect you and provide you a good food source. So, mitochondria, those little organelles inside the cells, probably have, and this is anthropologic, by the way, um, probably were ancient bacteria that lived in primordial earth, making energy from the red light that was coming through the primordial goo of the atmosphere. But that's just a guess. I don't know.
Yeah.
But anyway, my point is that red light activates the mitochondria and increases ATP production, which is the energy that cells use. And I'm not sure that we have mentioned it, but hair follicles are one of the most highly metabolic cell populations in your entire body. It's one of the reasons why, like, cancer treatment kind of knocks them out, right? It's because cancer treatments are designed to cut out the cancer, knock out the cancer. It also affects your gut lining, your bone marrow, guess what? Your hair.
Mhm.
So those are the top most highly metabolic cell populations, and they require a lot of energy and a lot of input. And so that's one of the reasons why I think red light improves hair growth. We also know that it increases blood circulation to the area. So that's super helpful, providing more nutrients, more oxygen, more fuel to the hair follicles is certainly helpful. Minoxidil is one of those things that also increases blood circulation as well as triggers hair follicle growth. So when you use minoxidil and laser together, you get kind of a double whammy, which is nice. And if you use
Mhm.
them kind of around the same time at the moment, you get more blood flow to the minoxidil that you just put on your skin, and you kind of get some good synergy going there. So you can certainly
Mhm.
stack those two treatments together.
Yes, I was going to say
Red
that.
light, red light is also great for healing after a hair transplant, and it reduces inflammation. If you have an inflammatory process on your scalp, it helps mitigate that as well.
Okay, amazing, amazing. I was going to say, look at you stacking therapies there. You're like a biohacker. Can you imagine? So good.
Can you imagine?
Can you imagine?
I'm, I'm all about that.
Me too. Me too.
Yeah.
I love a good stack for sure. So talk about some of the other things that I have we've sort of floated around, like the PRP, etc. What have you got going on there?
Yeah, so in the regenerative medicine category, we normally think about regenerative medicine of ways to leverage your body's own healing and regenerative capacity, let's say without pharmaceutical intervention or outside intervention. So, what would this typically be? Well, for 20 years, we've been applying PRP, platelet-rich plasma, to the scalp. PRP, you may have heard of because it's become super popular in the cosmetic world as well as orthopedics. They've also used it in dentistry. But platelet-rich plasma leverages the platelets that are within your own blood. and takes those platelets and helps them release their powerful metabolic signals, those biologic signals, those growth factors and triggers and cytokines, all those different things that the platelets contain for tissue regeneration repair, and push them into the scalp. So that's the reason why we want to take a small blood sample, centrifuge it, concentrate it, and create a PRP, platelet-rich plasma, deploy it back into the scalp. That's an in-office treatment that takes about an hour. The way that we do it is completely painless. And in terms of a stack, there's some different steps of the process that enable our PRPs to boost hair growth for about 10 to 14 months, sometimes even longer than that. But usually it's a once a year annual type of therapy.
Okay, amazing.
Yeah.
All right, exosomes. Let's talk about that.
Well, so stem cell therapy has also been a part of the practice for many years. Years ago, we used to do mini liposuction to get some fat cells and process that into a scalp treatment. We've kind of gotten away from that more recently, although you can now you can bank your adipose stem cells and actually have them multiplied and cultured and then reapply them back into the body for numerous different reasons.
Hmm.
But exosomes are the messages that come from stem cells. So think of, for example, an athlete who gets an injury in their knee, they get some kind of stem cell therapy. Usually it's based around either platelets or the blood or bone marrow or adipose. It's some kind of stem cell that goes into the area that tells the body what to do to repair and rejuvenate that area. Well, what if we left the stem cells in the laboratory and just took the messages that the stem cells would typically give to the body and use those instead? It's a little bit of a cleaner process, in my opinion, less risk of rejection or other inflammation and other issues if we're just using those biochemical signals. So exosomes are those little bubbles of information that come from the stem cells, and they're collected from the biotech companies. Let's say these are FDA registered laboratories that are well described stem cell lines, and they won't release the exosomes unless they've been totally purified, tested, sterile, quantified, concentrated, and then frozen and then sent to us. So we can deploy those exosomes as a rejuvenating treatment for the skin, the scalp, and also for the hair. Very powerful treatment. And one of the newest ways to use the exosomes that I found is to store the grafts while they're outside of the body, not only in our special solutions at the temperature with a little bit of laser on top, but now we're adding exosomes to the grafts in that
Oh,
storage solution. And what I've found, patient after patient, when we put those follicles back into the scalp, they're actually healing much faster, for sure, but growing much faster.
wow.
So we're talking like instead of 6 months to see half of the result, now we're getting half of the result in 4 months.
Amazing.
Yeah, so very
Amazing.
cool. I'll be lecturing on that at multiple conferences this next coming year. I've been an invited faculty member overseas for a couple of international conferences and also here in the States. And that'll certainly be one of the topics of discussion as we present the research and the abstracts from the what we call exosoak, which is our exosoak protocol. That's the way that we store the grafts in the
Yes.
exosomes.
How cool. How cool. Innovation on top of that. Everything else is just amazing. So thank you for this master class on hair. How did I not have you on before all these years? I'm so glad you're here now. Thank you for
Oh,
that.
well, Fiona, thank you so much for having me. This has been, well, Dr. Lovely, this has been really lovely, I have to say.
You know
I'm sure you've
something
heard that before.
I was going to say, Dr. Bowman, I've heard that before.
Yeah.
Okay, where can people find out more about you and your work?
So yeah, I mean, the most important thing, as we said earlier in the conversation, is that time equals follicles. So if you're out there and you think that you're at risk, or you've had hair loss and you're starting to see it, and let's say you're either teenage or young adult children who are in their 20s, the most important thing to do is to get an evaluation. So as the ponytail is shrinking, before you can start to see more scalp shining through, before your hairline recedes, it would be appropriate to at least get measured. And that's what we recommend. Now, you don't have to live in Boca Raton, Florida to come and get an evaluation. You can also see me in my satellite office in New York City, or you can connect with me virtually online. But even if you just want information, like what does Dr. Bauman do and what does he do in Bauman Medical? you can go to baumanmedical.com, BAUMAN medical.com. And even if you just want to check out, there's thousands of pages I've written there over the past 25 years. There's hundreds and hundreds of hours of video content that you can consume. There's frequently asked questions. There's information on all the variety of treatments, and then other things that we did not get a chance to discuss today, and things that are coming down the pike, like hair follicle stem cell banking and hair follicle cloning and all this other good stuff in the future. Even if you just want to ask a question, baumanmedical.com/ask, type in your question, give me a way to reply to you, like your phone number or your email. And I promise that my team and I will get back with you and give you some information. Or if you just want to sign up for a newsletter, you could do that too. But that would be the best way to connect with me. And like I said, we have in-person evaluations, but also most patients connect with us virtually first. So there's that discussion that happens even before you come into the office. And we can do that from your home or phone anywhere in the world at baumanmedical.com.
Amazing. Thank you for being such a great resource and available for these questions, because if there's anything I've learned, that there's so much taboo and shame around this menopause business, and when you start losing hair, it's like, oh my God, I don't even want to acknowledge it. It's like, well, it's over there, right? But there's so much that can be done is what I've learned today.
No, absolutely. And sometimes, you just don't get much respect from your local dermatologist, mainly because the discussion could be an hour. And that's a typical length of my conversations, actually, and evaluations, not including the measurements that we do, obviously, which you're not going to get at your local derm's office or Medi Spa. And, going on Amazon, buying a vitamin or a laser, things like that, may not necessarily be the right thing for your situation. So in order to get organized, I think it's important to connect with a board certified hair restoration physician. There are a number of my colleagues and I who are, board certified out there. There's about 200 of us that are out there in the world. I'm proud to be listed in one of the top 20 clinics in the world, and it's because we take care of our patients. We really understand what they're going through. Like I said, nearly 45% of my patients are women, and so that's an important thing for your audience to know, that there are many clinics out there that just focus only on male hair transplant surgery, and obviously that's not what my practice has been for 25 years. We have almost equal men and women all the way through. Of
Amazing. Thank you for doing that. It's such an important
course.
resource. Thank you so much. So, Dr. Bowman, I have a question that
Hmm.
I ask all of my guests. It's the
Okay.
very last question of, of the interview, and have some fun with it. It's a personal question.
Hmm.
Knowing what you know now, what would you tell your younger self?
Mm. Well, when I when I first started the practice, I didn't really know how it was all going to turn out. I just kind of like dug into it and went through some difficult times. And so I would just tell my younger self that just keep trudging and don't lose faith, because I think sometimes, when you're in the thick of it, you wonder if you've made those correct decisions or not, and you second guess yourself as you go through. And I think, obviously it's all part of the growing that we do, whether it be personally or in business. And sometimes it's all intertwined, as it was for me. Don't, I would tell him, hey, dude, don't worry about it. It's going to work out. Just keep your nose to the grindstone, and keep trudging through the snow, even though we're here in Boca, right? Not too much snow, but keep trudging through the mud.
Yes.
Just keep going. Don't relentless. One of my friends who is he does long distance runners and like all
Mhm.
kinds, he did running and all kinds of crazy obstacle courses. He always says relentless forward motion. And
Mhm.
I think that's a good mantra, for those of us who are in the startup phase of our businesses, or even in the evolution phase of our
Mhm.
business, as we try to continue to take care of more people. And certainly that's our mission at Bauman Medical, is to make sure that eventually we eradicate hair loss. It's no longer becomes a concern for any human. And in the meantime, helping those that are dealing with the hair loss situation while we're waiting for something more dramatic to happen in terms of cures or treatments. So,
Eradicating hair loss. What a cool concept. What a
well,
cool
that's our
concept.
ultimate goal. I mean, look, my dad is a dentist, and he always told me that the whole idea of dentistry was to eradicate the profession, right? Now, it's not so realistic. Everybody always has, some kind of tooth or dental issue at some point
Mhm.
going on, and certainly needs constant care and maintenance. So there is a little bit of, synergy and similarity between taking care of your teeth and taking care of your hair. There's no miracle cure for the teeth, although, we got dental restorations, and
Yeah.
of course, the proper management of your existing teeth in terms of dental hygiene is critical, and occasionally visiting your hygienist and dentist is helpful. It's the same
Good
thing for
idea.
hair. You've got to get that baseline measurement. You've got to get your care going. You've got to get your hygiene on point. You've got to get your follow-ups to make sure it's working and to your liking. That's if you care about your hair.
Mm,
That's the only caveat. But most of us, the ones that come and visit me, they're the ones like me and my team that we care about our hair and we want to keep our hair. We like our hair, and
yeah.
that's our mission.
I like it. I like it a lot. And thank your dad for instilling such a work ethic in you. It's amazing. Thank you
Well,
for
thanks
coming.
so much.
Yeah,
It's
you
really
tell.
truly been a pleasure.
Thank you. Thank you, Dr. Roman. Take care now.
All right. Bye bye for now.
The information and other content provided in this show, or in any linked materials, is not intended and should not be construed as medical advice, nor is the information a substitute for professional medical expertise or treatment. We are doctors, but we aren't your doctor. Seek your doctor's opinion. If you or any other person has a medical concern, you should consult with your healthcare provider or seek other professional medical treatment. Never disregard professional medical advice or delay in seeking it because of something that you have heard in this podcast or in any linked materials. If you think you may have a medical emergency, call your doctor or emergency services immediately. The opinions and views expressed on this page and in this show have no relation to those of any academic, hospital, health practice, or other institution. Thank you.